evolving. It is a serious situation now. It always was a serious situation, but I think we're starting to see, if you're paying attention to this, you're going to see major developments happening. There is massive developments all over the world, and everybody's going into, a state of awareness, let's say. And we're going to go through this video, this stream, and check out a lot of different updated news and some past news, and some tips on increasing your chances of riding this out. So first off, from around my area, this is what they're doing here. Okay, so this is like from Prince Edward Island's Department of Health, and they say all they say is Canada's chief public health officer is in close contact with PEI's public health office to monitor rapidly identifying and manage any cases occurring in Canada in order to prevent health of Canadians, or in order to protect health of Canadians. So the Public Health Agency of Canada is also working with provinces and territories and its international partners, including World Health Organization, to actively monitor the situation. And for our local risk level, it says public health risk is continuously reassessed as new information becomes available. It doesn't say any risk assessment. It doesn't say if it's low, it's high, or it doesn't say anything. But this is something. And I guess for people, for people in Prince Edward Island that are traveling here, going to these places, so this is our guidelines for management of the novel coronavirus. Person under investigation is a PUI. Just so everybody knows, that's abbreviated a PUI, person under investigation. And yeah, it goes through, you can find this on the government website and go through it yourself, but it's yeah. And University of Prince Edward Island, of course, they're giving some updates on this now. It says UPEI recommends that you seek information from official government sources as they continually monitor and update their websites. We encourage you to take the same general health precautions for COV as you would for influenza. The best defense against any flu is following routine prevention measures. Of course, hygiene and all that kind of good stuff. And they're just going to anyone who feels well should seek primary health care, kind of thing. So this is some local stuff, right? And just for people who have coronavirus who are returning to Canada, and this is just Canada in general now, it says, while abroad, you may have come into contact with novel coronavirus. For the next 14 days, the Public Health Agency of Canada asks that you monitor your health, fever, cough, and difficulty breathing, and avoid places that you cannot easily separate yourself from others if you become ill. That makes no sense. I don't know. Just stay inside, I guess. To further protect those around you, wash your hands often and cover your mouth. And, if you start having symptoms, isolate yourself and from others as quickly as possible. Call your healthcare professional or public health authority and seek advice. All right, and they got all these numbers you can call here. But, it doesn't say that they're under mandatory quarantine here. It just says that we ask you to do this and, out of your own goodwill. So, yeah, Canada prepares pandemic responsibility. Yeah, let's see. We are preparing, but we need to be very cautious at this point. We can take a lesson from what's happening in China. How fast their system got overloaded when people started getting sick and they had big breakouts of this. And now we are seeing bigger breakouts of this. We have Europe and the Middle East, It's big in Italy. Wow, it's crazy in Italy. They still haven't found the person spreading this, and it's only getting worse. And yeah, they're having a really hard time testing, and keeping up with the tests at this moment, as well, because all of our testing facilities are helping the coordinated world efforts, in diagnosing this, of course. So everybody's working together. It's a big chain link at this time. All the facilities that are able to test for this are testing for this, and they are experiencing backlogs at this time. So prepare for widespread coronavirus in the U.S. Yeah, it's only a matter of time before the U.S. or Canada, sees an outbreak, and they're downplaying this quite a bit, and I firmly believe that, and with good reason. They don't want to create panic. They don't want to, make everybody go running at the same time, because that's just gonna create bigger problems, right? So they have to be very careful with how they're addressing the world with this right now. But we need to take this very seriously, because the stuff that I've been seeing and the stuff that I've been following this for quite some time, and I've taken precautions from day one once I found out what was going on, and I'd have no regrets about that. I've taken, actually, some might call very extreme measures, based upon baseless, really, information. Just and I said to him, you can't convince somebody who doesn't want to see it, and if somebody doesn't want to see it, they won't see it, because we're so used as a society from seeing fake news and just bullshit being overblown. It's part of our daily agenda almost. So when something real does happen to come along into our laps, it's like the boy who cried wolf kind of thing, right? Yeah. So it's real, and a lot of people don't still believe it yet. And it's how bad is it going to be? Well, that's it's safe to say we should just prepare for the absolute worst. Seriously, like and we're going to get into that later about how to prepare for this, steps you should take. Of course, also going into psychological preparedness, preparing your mind for this, because that's a big thing too, right? We have to, and we have to address those things, and at least prepare, right? Like we would prepare for anything else, right? And that's all we're doing. I'm trying to get this out to tell people to prepare now, because when it happens, we don't know. We really don't know. It could happen at any moment, anywhere. And everybody's going to run to the stores at the same time. Don't be caught in that. Take your precautions now and get while the getting's good. You know what I mean? Like, really, nobody's really rushing right now in certain places, but other places, we can see everybody's rushing. And this official here in Iran, we're just going to watch this really quick. He actually has coronavirus, and Iran's got a major outbreak. The numbers are, wow, it's maybe 30% of maybe population infected. I mean, like, it's only spreading worse and more, and yeah, they have a problem with testing and stuff, right? They're not really a high income country, so they don't really have a whole lot, but they're relying on the other outsourcing. The World Health Organization's got things in place for countries that they can do testing, right? And almost every test they're sending out is coming back positive. So it's majorly breaking out, and we can't see this. It's moving silently. People can spread this and not have any symptoms, right? And I'm not going to sugarcoat this for anybody. The importance of this is now, right? And it's you just have to be prepared, right? And not panic, right? That's why the World Health Organization, all these people, are not really coming out and saying a whole lot, because people will in fact panic if you come out and officially tell them. So take the subtle hints that are happening, and it's real. Check this out really quick.
صنایع وجود داشت تغییر جهت
عرضم به حضورتون که
And you hear people coughing? You hear people coughing in the background?
شوینده ها و
Turn up your volume. Yeah, there's a lot of sick people there. There really is. There really is. And I can't stress this enough to anybody. It's happening there. It's only going to happen other places. Like Canada, we're going to have an outbreak here. We really will. And do you know why I know this? Well, because, they only stopped travel from China just like, I guess just now. Just today. February 25th. Air Canada is extending its suspension. Okay. Until April. Yeah, I kind of thought, I was like, what the hell? They must have been still going to maybe Japan or something. Or maybe something like that. I didn't think they'd be traveling to mainland China. So this is just an extension. Okay. But yeah, also we have a person who was infected on an airplane, who traveled from Montreal, who actually was in Montreal. They were infected in Montreal. Didn't know at the time, but they were infected. They traveled on this plane, infected, and possibly infected others on the plane. And those people got off. This happened February 14th. And this person and all these people have been who might be infected, have been just spreading this around who knows where. Right? So we need to take very, very, very serious thought about, the next steps. Whatever those may be for you. I know mine through and through. I've been planning this for 3 weeks. And, you can never plan enough. You can plan and plan and plan, but, maybe those plans might not work out at all. So, just, be prepared, right? Get your supplies and stuff. For sure. And this is a completely different case, right? And in Toronto, this is a completely different case from the BC to Vancouver trip. Montreal to Vancouver trip. And yeah, Toronto's got another one. And this person's been out doing their thing. Yeah, so we're just waiting for it, right? And let's go and check out some media. Some more media. This is an update from Canada's health minister. And let's just roll through this. I'm not going to interrupt it this time because I'm going to go for a cigarette. I've already watched this, but there's some vital information here, and they're heightening their awareness. We as citizens, we as people should be heightening our awareness, because they're not going to make us panic, right? That's their number one goal right now. In a real situation, you have to control the people. You have to control the panic. Seriously. So, just remember, if they're preparing, we should be definitely preparing. And I have been. So please listen and please do, because the medication's going to go. The fuel might not be so much because nobody's going to be traveling. There's going to be quarantines. So, but medications, food, water, toiletries. Those are the big ones that are going to disappear first.
Question period. Here is the Minister of Health talking about the coronavirus outbreak, Patty Hyden.
The United States, and along with our G7 partners, and I've been having weekly meetings with ministers of health, so that's been very helpful to understand where people are at in terms of their preparedness. I will remind Canadians that the American system is very different than ours, and we do have a pandemic plan, and we have been working provincially and territorially with our partners across the country since Dr. Tam noticed, in fact, in late December, the cluster of infection that was happening in Wuhan. And so we have an advantage of having that pandemic planning well in advance. We also don't need to call it a public health emergency in order to trigger all of those systems and structures to come into place. And we also have a robust system of testing, as you know, both at provincial level, but also the federal lab that's able to provide testing results very quickly and confirm testing at the provincial level. So we're in a different situation than the United States from an organizational perspective. But what I would say is that I reiterate their concern around the potential of an outbreak in Canada. You know, we obviously have been monitoring the situation closely, and as the virus has spread internationally, and countries are now finding themselves in circumstances that just a week ago they weren't. What it indicates to us is that the spread is happening, and that we must be prepared in Canada.
What can be done for the people in Iran, Canadians who are eager to leave?
Certainly, I think through Minister Champagne's office, they're obviously offering consular support, but I think we should be clear that repatriation efforts are limited at this point. It's difficult at this point to commit to an ongoing repatriation process. We have to remember that takes a lot of resources, and the resources have to be focused in terms of our domestic response. It's important for Canadians to realize that this may cause disruptions in their lives. It might mean that if someone is ill in their family, that people are isolated, that businesses may have to have contingency plans if in fact there is a outbreak in their particular community. And I think that's the focus that we have now, is really ensuring that provinces and territories have what they need from a health systems perspective, and that Canadians are taking steps to protect themselves and to prevent disruption in their lives should there be an outbreak in their community.
When the spread was contained in Wuhan, there were screening measures at the airports for people coming back from the region. So perhaps they were asked if they were coming back from Wuhan, if they had symptoms. Are you going to implement the same sort of pre-screening from people coming back from Italy or from Iran?
Because there's 35 countries in play now that we know of, and I would suggest likely other countries that we don't know of, screening becomes less relevant, and domestic delay and mitigation is more important. Let's not forget that it's also flu season, so if we can delay the onset of any outbreak in Canada to get us through flu season, it will actually alleviate the burden on our healthcare system, but it will also then provide us a bit more of a window to understand the virus and give some time in terms of possible antidotes for people that are ill with the virus.
But there are countries, if I could just get a follow-up, there are countries where it seems to be a bit worse than others, maybe less contained, like Iran at the very least. Is there no measure that you can take to have a better look at people coming back from there, given that we've now seen cases of spread in Iran?
So that level of screening at the airport has proven in previous outbreaks not to be efficient. So for example, in SARS, everybody's temperature was taken. Not one case of SARS was detected during that
or without
time.
Doing that,
but we have
suggesting if you have symptoms, maybe
so we are doing
isolated.
that. So there is new information for international travelers from any place to monitor themselves. In fact, if they feel ill or unwell, to contact local public health to let them know that they've traveled internationally. And obviously, travel advice is changing for people passengers that are choosing to travel to other countries. There is travel advice based on the severity of outbreak in those particular countries.
So it's not country-specific, it's just that wide, is what you're saying?
For international travel, for Canadians traveling outbound, yes, there is specific information and risk levels associated with countries' experience around coronavirus. Mm-hmm. But for people coming from international travel and returning to Canada or coming to Canada, the messages around screening for any concern around health.
Can we come back to, obviously, there's been a lot of this stuff has been limited to the people who travel internationally. But what is your message, and just recap if we could, for the average Canadian, be it on the streets of Port Arthur or in Etobicoke or, Lethbridge?
Right.
There is an element of the population that will get a little freaky about this sort of stuff. So
absolutely.
What's your message?
Well, first of all, I'm the kind of person that likes to prepare for the worst, and if we can say later on that we've had too much preparation, then I think I'd rather err on the side of too much preparation. And so I think for Canadians, the message is, first of all, protect your health, wash your hands frequently. If you're sick, stay home. If you're able to, determine that you're not feeling well, to stay home and prevent the risk of spreading illness in the community. I would remind Canadians that it is flu season, and to get your flu shot. It will help eliminate the flu if in fact you find yourself ill or severely ill. It will also help reduce the burden on healthcare, which we will want to be doing so that we can respond if there is an outbreak. And finally, I would say to Canadians that preparing yourself and your lives to be ready for disruption is always a good measure. Obviously, emergency preparedness is always a good measure. We don't know whether the power will go out or whether there will be an outbreak in our community, so having a supply of food on hand or your prescription medications filled up, those are always good measures to have. And I think when we live in a society that's just in time like ours, we often forget that disruption can happen whether it's a snowstorm or an outbreak. And so my message to Canadians today is to take it seriously. Obviously, we are working very closely. There's still, at this point is not, there are not many cases in Canada, but that could change at any time given that there is such a transmission globally.
Can you talk a little bit about, I guess, sort of the communications channels that are ongoing because the coronavirus has now become really a global health emergency that we saw a few weeks ago, but now, as we were saying, countries like Italy, Iran, and others. What is happening, I guess, behind the scenes to stay, abreast of the developments and keep Canadians safe?
Yeah, so at many levels, officials are working together to, from a public.
Anyway, I'm going to stop it there because it just goes into nonsensical information, really. It's speculative about, so yeah, it's about preparedness, right? It's about preparing and being ready right now because it can happen. And they even said it right there, but she said it with a little nonchalant, like, man, we should prepare in case the power goes out, fill up our medications, all that kind of stuff. They didn't really stress on it too much, but just kind of hummed over it. That's very concerning, right? Because they're trying very desperately not to panic people. And we need to realize it could go up, right? It really could. So you got to be prepared for that. Any moment there could be an outbreak in Canada, US. We never know where the next big one's going to happen because this thing is slowly it's slowly moving through our population right now, and we don't know who's really infected, because it's almost like flu-like symptoms, all right? And people are like, well, it's not that bad, but we have no idea what this is, and there's a lot of speculation out right now. Right? There really is, but whatever this is, we've never seen it before. And it's completely new to anything. So we're all very susceptible to this because we have no immunity to it. Nobody's ever encountered this specific virus before. So it will infect every one of us who comes in contact with it. And we don't know exactly what happens when you do come in contact with it. All right? We don't know, and I don't think you want to find out. No. So it's about taking preparedness right now. And that's my mission, is to get the word out to people. All right? And officials are seeking Quebec flight passengers who may have been exposed. This is from Valentine's Day. And this they just started looking for these, it was 10 days when they found out. From Valentine's Day 10 days later, and now they're going to go look for people? Give it up. No, you couldn't. Even if they infected one person beside them or two, right? Those two people are going to go on to infect maybe their families or their friends, and you just can't stop that now. 10 days in and you're going to go look for people? I highly doubt that. Maybe they might alert the immediate people on the plane. That's about all they could do. After that, it's really, and some more local news here from my area. High school March break trip is postponed now because of coronavirus. It's, travelers who sat close to infected passenger on Air Canada flight will be alerted. Quebec Public Health. Yeah, 10 days after the fact, or actually 9, 10. Yeah, right? Like, wow. Like, the ball is being dropped everywhere. They're not ready for this. Our system is not ready for this. We are so dependent upon an interconnected web to create, like, to keep this whole society of interconnectedness sustained, keeping it rolling. If something gets stopped, it does affect other things. If a whole lot of things stop, well, yeah, you just got the legs cut off, right? So, and it's happening. The stock markets are crashing. You know, they really are. They're just taking a shit dumping, and that's just to be honest. You know, the Dow went down another 1,900 points today. It was down, I think it was 800 points the other day. That's huge. It was like a 3% drop or something, and like unreal. So this is Dr. Eric Ding. He's an epidemiologist. He is a big pharmaceutical whistleblower. He's a guy you can watch on Twitter. You know, there's a lot of, he's posting it as it is. So, and he's saying, you know, this is not good. It's possible now that there are not that many milder cases, according to field investigations by the WHO ground team, or WHO. This means that the disease could be more severe than thought, according to Stats News reporter. And you just look at some of these comments, right? Weird stuff has been going on with social media. They have been pulling certain stories or hiding some posts under sensitive post alert. Legit stuff, not conspiracy stuff. And, you know, the WHO did ask social media to help them censor information. That is not a conspiracy. They really did. And yes, they did say that they were working with multiple platforms to bring us the truth, right? So, and also not panic the public. If anything is out there that could possibly panic the public, well, they scrub that really quick. Or try to, right? And here we go from the B&O newsroom. US CDC, we are asking folks in every sector, as well as people within their families, to start planning for this, because we have seen from recent countries that have had community spread, when it hit those countries, it has moved quite rapidly. Correct. B&O Network, San Francisco declares state of emergency. It's happening. If you don't go right to the store right now and at least get some fucking Kraft dinner or cans of tuna, you know, like, what are you watching me for? Go do something. Get what you gotta get when you can get it. Like, people who aren't affected by this right now, we're so fortunate. Like, I am going out tomorrow. I got another shopping thing to go tomorrow and pile up on more things. Right? It's not, and I'm being very cautious when I do that. I'm avoiding high traffic. You know, I go there when you know, just around closing time. You know, when the last couple of people are in there, I'll go in and make a mad dash and get what I need, right? That's just the way you got to avoid people, like, literally like the plague. Unfortunately, that's the way it's going to be, because we don't know who is infected. We really don't. And it's very important right now. If anybody, how, you know, we'd have to develop, you know, like a safe zone right away, and then you'd know that those people weren't infected, right? But then you couldn't let anybody in. Seriously, like, you'd have to block out a village or lock out a community, right? Like, just like they did in China. That's what they did. That's why they did it. That's why they blocked everything. That's why they shut everything down, because they knew what this was. They could see it happening. There's reasons why they dug up the roads, literally. You know, like, I'm not kidding. We're not being told what this is because it will panic people. I promise you. And that's the only reason right now. Everybody panics, it's all gonna go to shit. They won't even have a chance to get a hold of it. And that's just natural. That's just procedural protocol. That's basic protocol. Don't panic the public. Rule number 1 in any emergency situation: do not panic the public. And that's just the way it is. Right? Because if you panic the public, everything else fails. Everything. That's rule number 1. It seriously is. And it's only logical, of course. So, indeterminate tests as well. Right? We're seeing this a lot. Humboldt County, California, Department of Health and Human Services said Tuesday tests have come back indeterminate for a close contact of patients with confirmed case of coronavirus. Yeah, we're seeing a lot of indeterminate tests. The testing isn't working very well. And that is a major problem. And they're not actually testing for this very often, because the laboratories are actually really overworked right now on a global level. So most hospitals will only test you if you have been in contact with somebody from China or recently returned from China. That's the only reason why they would test you, especially if you might be showing symptoms or whatever. Right? They're just not going to test everybody. They'll just go tell you to go home and quarantine yourself, because that's all they can do. They can't let people really. They don't want people in the hospital that got this, because we've seen how it went through the hospitals in China. And if it went through the hospitals there, well, god damn it, it's only going to go through the hospitals anywhere else. Right? So they're sending people home right away. They're only keeping the most severe people. But it's only a matter of time before people in the hospital get infected, or a staff worker makes a mistake and gets infected and infects a patient and infects. That's how it happened. People are going to get overworked. The front line's going to go down. That's how it will happen. We don't have the resources to support this on a global level. I'm sorry to say, we don't. We really don't. It would have to come down to community-based survival. You know what I mean? That's where it's at. Because we're already stretched thin as it is with our resources. Like, Canada's pretty well prepared. Like, we got, you know, we're not bad, you know, but the United States did a lot of cutbacks on certain things, and they are not prepared. That's just the truth about it. You know, because Trump cut back a lot of spending on these so-called extracurricular programs that, and one of them being, you know, unfortunately, emergency response. Or disaster response, I guess, or whatever you want to call it, the EPA and all this stuff. We cut them out. So it might be tough, right, for some people. Yeah, and Trump gave a, you know, everybody's asking, what the hell? Because they're supposed to give us stupid information like this and just keep us guessing. It's better than to keep us panicking, right? If we're guessing, we're not panicking, right? It's just classic psychology. It really is. It's not fucking. So China postpones parliament for the first time in decades. Yes. And, you know, China's like, don't worry, we're all going back to work. But here, we're just going to cancel our parliament, and which has never been done in a long time, because, you know, it's a communist country. And I firmly believe that probably, I'd say, some top officials are infected. There's definitely top officials infected. You know, people weren't taking the precautions with this, and it was spreading a lot more than what people, I think, initially thought in China. And it is game over for China. I'm sorry. There's no saving that place right now. Really. The people that might have a chance, if they go to the woods, if they go to the wilderness, and, you know, towards Mongolia, Russia, like, I don't know, maybe not Russia, but, you know, maybe the Mongolia border or something, like, I don't know. But, like, that's really the way. If you're not infected, you'd want to get out of the cities. You would never want to be near any population area. You'd have to go and live off the land. That'd be your only bet in China right now. Seriously. And, like, the cities that aren't really infected, that aren't really, like, almost every city's quarantined there to some extent. It really is. So you can only, you know what I mean? run for the hills. Seriously, that's what, if I was in that situation, I knew I couldn't get out of China and I was stuck there, or, you know, for whatever, like, I don't know, I would definitely try to get whatever supplies you could and travel for the mountains, right? Tibet would be a nice place to go, but natural resources and all that kind of stuff, you have to think about that. And yes, I am definitely thinking about this. Because if this goes as bad as it is, and I really believe this is Virus X, or whatever you want to call it, but like, you know, it's a black swan event. It's going to literally wipe out everything at the core first, and then it's going to ripple out. All right, so we have to take this extremely seriously. And, you know, we can only take certain level precautions. You know, like, you're going to have to develop, like, a game plan, right? And make like a phase 1, you know, get ready and prepare and be aware. You know, that's like your phase 1. Your senses are heightened. You know, phase 2 might be, well, there's an outbreak nearby. So, you know, you might want to do some extra, you know, whatever your phase 2 might consist of. And, you know, obviously, they're, you know, just complete bailing for a remote location is, you know, obviously a last resort. But it might come to that. And you'd want to be able to have fresh water. You want to be able to have at least some shelter, right? And a way to have sustainable resources, fishing. I am in a place where fishing is plentiful, and I have no problem fishing, and I have no problem living in the woods. Not one bit. So it could come to that. But just like a big fishing trip. Yep. So, you know, it's planning, right? It is. And it might sound like absolutely fucking bananas to be thinking like this, but it's real, and I can't stress it enough. This isn't, you know, like SARS, or this isn't like what we think it is. Even if the virus doesn't get us, it's going to crash the grid. It will. It's just inevitable. Honest to God, we can't stop it, right? So, what's going to happen? It's just going to keep spreading, right? Eventually, just keep spreading unless we find a cure. But even most officials are saying, hey, we are at least a year away. At least a year away. So let's just go and see what we know. First clinical trial participants was an American currently at the Nebraska Medical Center in Omaha who had been quarantined with other infected passengers from the Diamond Princess cruise ship. So this person got a first trial. While we can be fairly certain that the first trial participant won't be in a hurry to take another cruise, it is really all we know about this person at the moment. And they're using an HIV medication on him. Gilead Sciences, I'm not sure if I'm pronouncing that right, but they are using this drug called remdesivir. Sorry, anyway. I can't. There's too many silent letters in there. But anyway, it's an HIV drug. It is. It's used for treating HIV, but what it is doing is it's acting as a disruptor for the virus to stop it from communicating with our cells so it doesn't infect them. So they're trying to stop this before it happens, right? In our body. They're trying to use this specific drug here, and stop the communication, right, between the virus and our cells, before it infects our cells. The virus can be in our system, but if it can't infect our cells, it's perfect. We got mosquitoes, or actually, they're kind of like called dandy longlegs, and where I live, and a lot of people don't know this, but they're actually extremely toxic, and they could kill us. But they don't have the ability to bite through our skin. They just don't. So they're not, they're not toxic to us. But if they could bite through our skin, they could kill us. And we played with them as kids and stuff. I never knew that, but it's actually fact. So it's the same way with the cells. They can be around us as long as they can't infect us. Then it's they're dormant in a sense. So yeah, this is just a trial. They know it's not a cure. It's not really a cure. But let's just check this out. This guy's a Chinese billionaire, and he is living in exile in the United States. And this isn't just a story I'm making up. You do some research on him. His name is Gao Wengu. And the Chinese government hates this guy because he actually knows a lot about them, and he's a billionaire, real estate billionaire, and China was kind of strong-arming him because, he was a powerful person. Anyways, they had their differences, and he exiled to the United States, and he's still a real estate mogul, and he is a whistleblower about what goes on in China, and a big critic about the Chinese government. So anyways, this guy knows quite a bit, right? And I firmly believe what he is saying. And he talks about here about how many bodies that they're burning, and though, obviously what we're being told, the amount of people that are dead as of right now from this virus, they're burning those many bodies per day in Wuhan. So let's just check this out.
武汉的火葬场49个啊，而且现在是大家现在了解是错的，事实上是51个。重庆的咱们战友告诉我说，看不着当官的了，找哪都找不着，打什么电话都找不着。重庆的、东北的人家人死了几天了，打电话收尸，没人来收尸，只有把家人尸体从楼上扔下去。现在哪有火化呀？都是活埋和直接就能土埋了去。这是真相啊，兄弟姐妹们！现在已经官方承认，死亡人当中60%是在家死亡的。啊，20%、30%是在医院治疗和路途中死亡的，这是他说的。那么现在你把尸体扔到楼下去，这个尸体会再染多少人？我请大家有个常识，一个到日本的货轮游轮，一个人传染，从1个到60个，60个到70个，70个又发现60个，现在130个。不是，这游轮好像是不是就比中国的游轮低级是吧？比那武汉的游轮低级是吗？比那个中国的高铁低级是吧？传染只有那个，所以说造成这个1到103的传染，你们信吗？那武汉天空中那全世界可检查的软件，只有郭文贵告诉大家，武汉的火葬场49个。啊，而且现在大家现在了解是错的，事实上是51个。啊，每一个火葬场别说19个炉子，10个炉子，一个天只烧200具身体，150具身体，算多少人，烧多少天了？天空中的整个二氧化硫的浓度1700多，烧啥呀？一没工业。2没生产，3没有汽车，怎么来的？你能骗得了世界吗？
This guy is telling it the way it is. And a lot of people are, but a lot of people don't really believe that it can be as bad as it is. But I promise you, it's probably worse than you could imagine. And that's not to freak you out or cause panic. But you need to be aware of this so you can take the proper precautions now, right? And that's what my message is to people, all right? And I'm not a streamer. I don't give a shit about the likes or share this. right? Share it, because people need to be prepared for what's coming, and it could happen at any moment, anywhere at any time. It could pop up, and we could have an outbreak of this, and then all of a sudden quarantines, right? So you do not want to be caught running for all the supplies while everyone else is running for the supplies, right? Just saying, prepare. And I can't stress that enough. My connection's interrupted. What? Yeah. And you know, like everybody was saying, Wuhan's going back to work. This was yesterday. They eased the lockdown measures, and then 3 hours later, they put them back into effect. So it was just a ploy, right? It's just a ploy. I don't know what to think, but obviously it's almost like China's doing this on purpose, just like they want to infect the world or something. And it's like, what the hell? Like, why would you, like, if it's, you know, they're still in denial that this is anything. I don't know what the hell, man. They, like, wow. Really, it is. And, oh, yeah, it's crazy. The misinformation is in the media. That's where it is. That's where the false news is. That's where it actually is. This time, really. You know, they're trying to give people a false sense of security. But they're trying to not panic people. And that gives people a false sense of security. So people aren't taking this as serious as they should. Yes, they're reporting on it. Yes, we see all the headlines and all the news. But I don't think people really understand that I really believe this is designed to kill. I really believe that. I believe that. Just because of the whole secrecy behind this, and not only like it's hard to explain it without sounding like, you know, like a conspiracy theorist. It really does. Because it just seems like it couldn't be real. And most people are just going to believe that until it happens in their town. Right? Don't be one of those people that's not prepared and you're going to panic. You can't panic while everyone else is panicking around you. Right? You can't. If everyone else is panicking around you, that's going to give you a really good chance for survival. Because people are going to be making mistakes and they're going to be stupid. Right? If you can keep a chill head about yourself, you can maneuver through it. Right? I'm telling you how it is. It's very important to at least be prepared. Like, we prepare for snowstorms, we prepare for hurricanes, we prepare for natural disasters in case of floods. You know, we prepare for camping trips. It's not going to be any different than a camping trip. It's just, you know. And if you never prepared for a camping trip before, yeah. I don't know what to tell you. You're going to have to learn to survive. Surge in South Korea, like, yeah, like, we're just gonna, it's just a matter of time, honestly. And I'm not trying to instill fear in people. And if, you know, most people aren't gonna want to listen to this because they can't listen to this. Oh, that's bullshit, is what they probably say, or, you know, like, or and, you know, like, a lot of people are not gonna be able to handle it. Unfortunately, they will panic. You know, and that's just going to create a worse situation for them. On top of a bad situation already. Right? And that's what their main objective is at the highest levels. Right? Don't panic people. Because if you panic people, you lose control before you can even attempt to get some control. I believe that this is way worse than what we're being told. And it's purposely being trickled down to the lowest levels, you know, to our provincial levels, you know, our state levels, where the broadcasting, they're not being told anything. They don't know anything, so they're broadcasting like, but they got their suspicions. Everybody does. But, up at the highest levels, they know exactly what's going on. Right? And their mission right now is containment. Right at this moment. But containment, I don't think is possible anymore. I really don't. So what they're going to be doing is focusing on outbreak. Each outbreak as it happens, they will go to it and address it and quarantine it. Next one, they will go to it, address it, and quarantine it. That's what they're doing. That's what they're doing in Italy. That's what they did. They went to Italy and they got the army there. Everybody's guns, like fully automatic guns. You know what I mean? Like it's a, god damn it. So, right, it's just a matter of time before it pops up, right? And it might be a weird feeling, of course. Nobody knows how they're going to respond to this. And yes, we definitely need to take this into consideration. So I just got a couple of things here I found. I haven't even, but what to do if the grid did go down? What to do? As they even said that in the public broadcast through CBC. They kind of just very vanilla and sugarcoated it really nicely for everybody, but they did say the power could go out, medication and supplies are going to get low, but they didn't say they were going to get low, but they said you should refill your medication if you have some. That's what they said. That's kind of, you may already read or seen a variety of articles about what would happen if the grid went down or how 90% of people would die. Yeah, a lot of people aren't going to be prepared for this. A lot of people wouldn't have survival skills for this. Seriously, we're so dependent upon technology and our perfectly little functioning system that if anything does happen, nobody's really prepared for the worst. We've gone through a little while, but I don't think nobody's ready for this. Certain people can be ready. Certain people are going to have the mindset. Those people will probably have the best chance of survival. All right. Other people are just going to panic and they're just not going to know what to do. And it's going to create a hairy situation after a while. Because, let's just think about it. People are very unique. Everybody is going to handle this a little differently, right? So, no more supply trucks. That's a big one. If they quarantine places, especially China, we have no supply coming in and out of China right now. Medications, anything technology, like I'll just say everything. We don't have it. It's not coming out of there anymore. So that's a big supply chain disruption for China itself. But then what about your provincial or your state level supply chains? What if they come and lock down, let's say, Toronto? What if they come and lock down Vancouver? Or, you don't know how this is going to unfold. This thing could go at any moment. And it is. It's just a matter of time now. And I can't stress that enough. It's not if it's going to happen, it's when it's going to happen. Seriously. And it's going to happen sooner than later. So, not to freak anybody out, but you got to take this seriously and you got to be aware of it. You can't pretend it's not happening because that's just denial, right? You got to face this head on. You got to put on the big boy pants, the big girl pants, whatever you need to do. But it's time to hunker down and see where, take this, at least face value right now that what I'm saying is extremely urgent. And let's hope it doesn't go batshit crazy, but we can only prepare for the absolute worst at this time. Because if this doesn't stop spreading, well, it's just not going to stop spreading. right? And the only way to stop it from spreading is to eliminate human-to-human contact with people who are infected, right? And we don't know who's infected. So what do we do? The people who have, small communities already should be like, if I had the power, without getting arrested right at this moment, I would be like, let's lock down this community and get people in here and just hunker down, because we know these people aren't sick, because, people are going to need to be together in a sense. You don't want to be by yourself really, because later on there's going to be bigger groups of people, let's say. And how do we know this? Well, because I watched every season of The Walking Dead, and I know how this shit works. Yeah, it would. Well, really, honestly, I don't know if it'd play exactly like that, but like you could pretty goddamn sure it's like, it is a viral infection, right? And it might not be zombies, but anybody else who is later on, we are going to treat them like zombies because we're going to think that they're infected. If we're not infected and we see like another person that we don't know and they're by our group, it's like, hey, who the fuck's this guy? How do we know you're not infected? You got to stay outside for like 60 days or something, and if you die, well, too bad. But I don't know. Yeah, that'd be the only way you could be sure that like this person's not infected and they can come in. Maybe even 90 days. I don't know. You'd want to be really sure, right? And that's where my mindset is right now. It really is. Around that level. So all the stores will close again, of course. Quarantine has happened. It's happened in China. We're seeing it in Italy. We're seeing it in South Korea. We're seeing it everywhere. It's the same thing that's happening everywhere. It's a model. It's exactly what's going to happen everywhere else. When a quarantine happens, the exact same things are going to take place pretty well. It depends on where the quarantine is and who is involved. Of course, things could get a little out of hand down in Alabama. I don't know. In Texas, what do you think? Fucking Texans, boy, I'll tell you, they're not going to stand for that shit. Don't fuck around with Texas. Yeah. I don't think the quarantine worked too well in Texas. People just be like, nah, we're just going to leave Texas alone. They'll figure it out on their own. They're self-sufficient people. So schools will be shut down is the next one. All right, we're seeing that also China, and everywhere else. Of course, you would have to. Right? There was actually a news report I seen, and I'm not sure. I think it was in the Middle East. It was in the Middle East, where a bus driver tested positive. A school bus driver had tested positive, and he didn't know. He was, of course, driving kids around everywhere. And the Middle East it's got some big problems right now because, of course, they are lacking testing capacity. The World Health Organization is kind of trying to alleviate that stress, but still they can only, do so much because they're trying to help everybody, right? It's like, hey, you can only stretch yourself so far. And unfortunately, it's I think it's a lot worse in the Middle East than we're being told because we got cases popping up everywhere now. Commerce would cease. So your money's going to be no good. And if you have friends that are really good at like scavenging, you might want to send them a text or something pretty soon and just being like, hey, what's up, buddy? So, stay in touch. You might be able to use cash for the first little while, but after a while, no, you wouldn't, because money's going to be useless when it comes down to it, right? It would. Later on in the stage, at first, it'd still be, gasoline will be gone. No, I don't think gasoline's going to go anywhere because, well, not too many people are going to be traveling considering quarantine measures. Definitely gas is not going to be an issue. Cell service would stop. Yeah, well, that's possible. So that's another good thing I should mention. If you have friends who are shortwave radio operators, ham radio operators. My next door neighbor is a master. He's been doing it for like 60 years. Yeah, and his whole backyard's basically like a fucking antenna. He could talk to people on Saturn, for fuck's sakes. So one reason why investigating an other communication device would be important, such as a ham radio and a CB radio. Yeah, CB radios work as well, of course. You know, they are, but they're limited in their distance, of course. You know, you might only get like a CB radio. You might get without a booster. You might get 20K. You might get 20 kilometers, 50 kilometers, depending. I don't know. If you had a booster though, like a signal booster, you could definitely stretch that longer. Air conditioning won't work. Yeah, I don't think we're gonna be. Heaters wouldn't work. Yeah, post offices wouldn't work. No more running water. That might be an issue. You know, if most municipalities though would have a way to keep the water up and running for at least a little while, right? I'm sure of it. You know, they do have backup power for that kind of stuff. Unless, you know, those people that are operating that stuff are still healthy. You know, if you know, the people who are engineers who are operating all our vital, let's say, you know, all our vital needs, power and everything, like all these nuclear power plants, all the power plants, every sector everywhere that would be dependent, you know, we'd have to make sure that those people don't get sick because we need those people. Yeah. Emergency preparedness program. And it's serious, right? We gotta really check this out. You know, canned goods, dust masks, sanitation supplies, of course, battery operated or hand crank radios, extra batteries. Money's not going to really matter, I don't think, but if, you know, for the first little while it will. You know, yeah. Just like a camping trip, right? It'd be like the same thing. You know, you could stay in your house for a while, but if you're in a big city, I don't think I'd want to be in a big city. I'm kind of like in a more rural area, but yeah, it's tough, right? Like if the grid goes down and our communications go down, well, we're gonna have to either drive to people's houses to like talk to them, and hopefully they're not infected, and hopefully, you know, because I really believe that this here is going to be the big one, and you know, it's not. I don't think it's gonna wipe out everybody. But I think it's definitely going to wipe out our supply chains. And, you know, a big one here. Seeds. Seeds would be more helpful. Yes. And especially some cannabis seeds as well. 100%. But seeds, yeah, you can grow vegetables and stuff with seeds, right? They're better than vegetables themselves because vegetables will actually degrade unless you, of course, you know, take some time and preserve them. You know, preserving food for years using sun drying and other natural methods. You might want to brush up on this. You know, smoking food, salting food. You know, I used to cook a lot, so I'm all right. But even still, we need to get those supplies that, you know, you don't need the supplies if it comes right down to it, but for preserving, you know, salt is always good, but you still need to get salt. You know, spices are a great thing to have on hand. You know, they really are. They have a lot of benefits. Not only tasty, but they are good for us. Antioxidants and all that kind of good stuff. So, preserving your foods, like preserving stuff, vegetables, anything. You can preserve like cooked steak and hamburger, and you know, if you do it right, and yeah, it'll last for years, literally. But planning is key, right? You got to plan, and if you don't plan, well, You know, you can only you can lead a horse to water, right? But you can't make him drink. That's an old saying, you know, and it's true. Like just like we're preparing for a natural disaster, right? But you also got to be prepared. Like you got to be aware of what's happening. You know, you can't pretend that it's not happening because that's only going to make it worse. I promise you. We all know what happens when you know, pretend that things don't happen and they are. It doesn't fix anything, especially in a survival situation. That you don't have time to fuck around like that. You can't be playing games with yourself. You have to be, you know, facing this front on, and being aware of it, and at the same time, it's going to give you, you know, hopefully, it's going to allow you to be extra heightened and not, you know, not just panic you. Because there's a fine line between, you know, being aware and you know, panicking, and some people will tread that line very, 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 very lightly. Yeah. So prepare and practice. Well, practicing probably doesn't. You know, we could practice and do some, but not really much time to practice. Preparing, yes. Stay calm and adapt quickly. That's good advice, actually. You know, like you're gonna be obvious. Like staying calm is you know, it's an easy thing to say when they're like, holy fuck, the military's rolling in, they're quarantining the city. Yeah, that might be easier said than done. So, you know, you can only prepare as best as you can, and if you're aware of it, you know, at least you might be able to tuck and roll with this, or you know, absorb the fucking brunt of it. Because it's gonna, you know. It's everybody's going to be affected by this differently. Yeah, so survival skills are going to be tested. They really are, and I have no problem fishing for the rest of my fucking life in a woods, in a cabin, and somewhere. Stock up on generators, you know, and fuel. Like you could only do so much, but you know, as long as you could get what you could, and you know, you might have a good chance, right? Medications as well, you know, anti-inflammatories and antibiotics, big ones, right? Big ones. But not only antibiotics, you know, there's a lot of antiviral oils that we have, natural herbs and stuff, which are great to stock up on, right? Clove oils, cinnamon, nutmeg, ginger. It's good stuff, right? Get out of our comfort zone. Yep, that's gonna happen. Actually, I'll just probably be getting into my comfort zone while everybody's like freaking out. I'll just be like, okay, I can handle this, I think. Let's go fishing. Get the cooler, get the fridge, get the fridge. Yeah, you know what? Actually, if it come right down to it, do you know what I would do? Seriously? I would take a transport truck with a reefer cooler on the back of it. I'd fucking stock her up and I'd just roll right to the woods. I might even go back for a second load. You know, because why not? Like, and then you have your, you know, a reefer trailer. You can keep that thing running for days, you know, on a little bit of diesel. You know, if you had a diesel truck, let's say, I know, not a truck, but an actual fuel truck, like a whole fuel truck. You know, you that probably lasts a person, few years anyway, at least, keeping everything running, generators, fucking power, right? That's what I'm thinking. And you know, I might be running to the woods if I have to, but it's sure as hell gonna try to bring some creature comforts with me. You know what I mean? Especially some sugar, a lot of sugar, and some yeast. And we all know what sugar and yeast makes, right? Fantastic beverages. Because alcohol sometimes, you know, actually it always is a solution. And then science even supports that. So, you know, you might want to have a couple of barrels of bourbon or something kicking around. Natural disasters leave more than a path. Yeah, you know, psychological destruction. All right, you really have to be ready mentally. And, you know, you can never prepare. You can be aware, which is the best. You can't prepare mentally. You know, you can be aware. And that's your best preparedness, is being aware and accepting. Don't fight it. If you fight it, it'll fuck you right in the ass. I'm sorry, I didn't say that, but it will. Because you can't deny it. Right? You can't pretend it's not happening. And seriously, you know, I'm not a psychologist or nothing, but tried and true. I've been through it, and I might have been on different levels and different people, but you know, you can only explain so much until your natural instincts are going to kick in, and being aware that that is happening is going to help you get through this, and understanding that you are only a human and they are only emotions. Right? It's big steps, but you got to take it a little bit at a time. Mentally, because if you take a big jump mentally, you know, it's not good. You got to ease yourself into it. That's the best thing for any mental situation, right? But you can't obviously overdo it, right? Some people, you can't. If you're losing sleep thinking about this, well, you know, you're probably beat already. So, you know, get some music, get some marijuana, get some liquor, you know, I don't know, get some good opioids, whatever's your fancy, right? What, you know, whatever's gonna help you, you know, ease into it, right? And you might need that, because I personally believe that we are heading for that place, because like, how's it gonna stop? You know, it ripped through that cruise ship like wildfire. And that just goes to show you how contagious it is. Really. They say 600 and some infected. I would say almost everybody's infected, including the staff. My personal opinion, if anybody's not infected, they're so lucky. Yeah. And it's you know, risk level. Well, we just don't know yet. It's constantly being monitored. We'll let you know whenever it's too late. That's my take on it. It seems like, I don't know, it really does. Let's just check some really quick news here. Let's go. Bam. Best match anytime past hour. Most recent, CDC is warning coronavirus is likely on the verge of triggering a global pandemic. Well, actually, theoretically, it is a pandemic right now. They just haven't called it a pandemic because they're scared of the P word. No, not panic. Pandemic. Because it will create panic. One P will lead to another P. So they don't use those words right now. And you've got to be aware of this. Because when it does overflow, you know, it's just going to happen. They don't really give a fuck. They're trying to stop everybody from panicking. They don't give a fuck if you get quarantined. They don't give a shit, you know. They're trying to create or trying to stop the panic, and you know, that's important, but it's giving people a false sense of security doing that. How to prepare for a likely US outbreak. It's not likely, it's gonna happen. And it's gonna happen everywhere. And it's only gonna keep spreading. So, what do you know? I'm telling you right now, with the utmost honesty, and as far as I'm concerned, you should not even be listening to me right now. You should be out getting some shit together. Really. But don't panic about it, right? You can't. And we gotta face this. We gotta absorb this for what it is. And will warming spring temperatures slow the coronavirus? Well, it's in Egypt, so no. And it's in the Middle East, so no. That will not slow it. And actually, considering the numbers coming out of the Middle East right now, it looks like it's thriving quite nicely. It even looks like it's gaining steam. But I don't know. It's hard to tell if this thing is picking up or slowing down, because the news reports, out of China, one day they're doing the PCR tests, the next day they're doing CT scans. So we can't even, estimate the flow of data because it's been interrupted so many times by changing the testing methods. We can't even make a... We're not going to get into the numbers, but I promise you, we are not even catching 2/3 of these cases. Like, we're not. It's just the way it is. So be very careful when you go out. You know, seriously. Like, I'd rather people be aware and get a heads up on this than somebody being fucking stuck in that goddamn rat race when everybody runs at the same time. That's exactly how it outplayed in China. That's exactly how it played out in Korea. That's exactly how it played out in Italy. What's going to play out the exact same way everywhere else, right? It's cookie cutter. You know, it is. It's cookie cutter experience. It's going to be exact same thing everywhere. Once the outbreak happens, the quarantine's going to take place. And depending where you are in this quarantine, or if you're in the zone, if you're outside the zone, you could guarantee that even if it's in your province or state, there's going to be panic. And everybody's going to start running at the same time. So don't be those people. Right? And there's going to be certain measures we'll all have to take eventually, I'm sure. Right? And I just want to get this word out. Because I've seen this coming for a long time. I've been following this since day one, and I took my precautions day one. Like, on January 23rd, I basically quit my job. That's how confident at that time I was. There was some batshit crazy stuff going down. I got my family ready. I got some supplies at that time. People thought I was fucking crazy going shopping with gloves on, and like, I was like, what? You have no idea. I don't care if I look like a fool. I've looked like a lot worse fool than this when I'm drunk. I don't give a fuck. I'm going shopping and I'm going to protect myself. And that's the way it was. I'm not taking any chances. You know, we can't see it, right? It's very, very elusive. It's hard to detect, and we're not catching all the cases. So, you know, it's just a matter of time. And it's the same thing that's happening everywhere. Right. And like, you know, like this here, a woman infects 5 people and she's like completely healthy. That is some scary shit. And that's why when the science came out about this like weeks ago, but this is just making headline news now. But, you know, weeks ago, some preliminary reports came out that showed that this was some crazy, you know, it has some very unique characteristics. It can infect us in such a way that there's nothing else that we know that infects us this way. And it's extremely, extremely infectious. We know that. I knew that back then, but they're only coming out and telling most of the population this now. And my friends, my family, and everybody, like, back, like, I was like, my whole wall is just full of this because it's a timeline for me. But it's also a warning to people. But at the same time, everyone was saying, "Oh, dude, you're just feeding into the conspiracy theories, and you're only making the situation worse." I have no control over what that virus does. No matter what comes out of my mouth or what streams over the little wires in the internet is not going to change the course of this virus. Except, you know, people, you know, they will deny it. They will deny it. That's actually, I think, you know, it's that's just the way it is. They will. So, and we will see it unfold in a place near you very soon. So if you have the chance and you have the ability, you know, you got a cabin, you got a tent, I don't know, you know, but it's hunker down time. I think it really is. And I can't give anybody advice on what to do, but I know what I did. Right. And I'm only giving this advice and sharing this with people, because, they're not going to share it with us because they're trying to keep the public from panicking. And in order to keep the public from panicking, you must bend the truth or just outright tell it lies. Because, you know, you can't do both, right? You can't tell the truth and not panic people. And we know that this is, or at least I know that this is something that we need to be taking very seriously. With that being said, I'm going to leave it there. I might do another update very soon. It is midnight. Yeah, we're going to get some news, and I'm going to go through, some science, and maybe get some, I'll show you what's going on. I'll continue to show you as best as I can if you want to know, and keep you updated with the current events as they happen. So, thank you so much for watching. Share. I don't care if you like it, but just share. Get it out there. Take care. Be aware. Peace.